Welcome to A Derm and an Allergist Walk Into a Bar, the only bar where the drinks are optional but the sneezes, hives, and skin problems are always on the menu. I'm Dr. Martin Smith, board-certified allergist.
And I'm Dr. Taylor Bullock, board-certified dermatologist. Together, we share stories from the clinic about patients and conditions at the fascinating crossroads of skin, allergy, and immunity.
So pull up a chair, order your favorite metaphorical cocktail, and join us as we dive into the wild, weird, and wonderful world of skin and allergy. All right, Taylor, I'm going to just ask you this. What is the weirdest thing someone has ever come to see you about?
There's this disorder called Morgellons disease. Basically, patients will tell us that they swear that they have fibers or bands buried within their skin.
What?
And they will swear by it. And it's not uncommon for people to say that they'll have dog hairs or human hairs just buried inside their skin.
Are they like picking at this?
Yes, just they will pick out their skin everywhere. It's actually terrible to see because you feel so bad for them.
Yeah.
It actually reminds me of this one patient that I had. She came in, was just picking at her skin everywhere, and she swore that her dog's hair was just trapped under her skin everywhere. Of course, we looked at her skin. We didn't see anything, but she was just picking her skin to death.
Dude.
But this is the real kicker. She brought in her 6-month-old with her.
Oh, no.
And her 6-month-old did have quite a few spots on her where you could tell mom had been picking.
Oh,
and so
boy.
it really did end up being a pretty large event where we had to intervene quite a bit. But it's a devastating disease that we see surprisingly often. We see it more often than you'd want to see.
I've never heard of that. That is wild. So, Taylor, I see this in my practice a lot, but can stress make you break out?
Yes, I probably hear this question without a doubt every single day. And the answer is yes, clearly it can. I think some people, some even dermatologists will say that no, it doesn't cause breakouts. It's clear that for sure there's an association.
100%. You see those exam students, right? They come in, the midterms are coming up, and their face is just riddled.
Of course.
In my practice, I see it with urticaria. So urticaria is just these random hives that come out of nowhere. It's called idiopathic, meaning we don't know what causes it, but we do. There's several things, and stress is the most common cause.
I couldn't agree more. In fact, oftentimes with many skin disorders, I'll say stress isn't necessarily the cause of things, but stress can often be the trigger for making you have the presentation or erupt with whatever you have at that time.
Isn't that true? We both treat eczema, and I remember I had a patient, a businessman, who used to fly to the West Coast a couple of times a month, and he told me he hated flying, but it was part of his job. And literally every time as he was getting ready for his flight, his eczema would flare. We could do whatever, immunomodulators, creams, everything. And then I told him, take a break for a month. I'll write you a letter to your boss saying you cannot travel. He did not have any eczema.
And you can imagine that patient going to a physician and their physician telling him that stress is not related to the eczema. Imagine the gaslighting that could happen with that.
It happens, right? We see some of our colleagues are saying this to patients. It's in your head. It's not this. You're using the wrong soaps. You're doing something wrong. No, stress is it.
Yeah. If there's anything I've learned, it's that you can't go wrong with having an open mind.
100%. The mind-body connection is real.
All right, so I got a good one for you. Where's the weirdest place that people get an allergic reaction that you've seen?
Like you, people show me a lot of rashes, right? I see eyelid dermatitis from nail polish, belly buttons with contact dermatitis from nickel in the belt buckle. I see some rashes down there from latex or even anaphylaxis from it. So pretty much there is no body part that is spared that I have not seen an allergic rash from.
That's terrifying, really, the locations that you can have allergic reactions.
You can have it everywhere, and you can have them unexpectedly. You can use the same product and you think it's not going to happen to you, but it's all fair game.
We've talked about this many times, but the amount of patients that come in thinking that they're safe from having an allergic reaction because they've used a product or used something their whole life and never had a reaction, right?
Exactly. Like getting those patients to believe that their beloved shampoo that they've been using for 15 years has got MCI in that they're now allergic to, they don't believe it because they think the longer they use it, the more it shows that they're tolerant to it. But we know that low dose chronic exposure to these allergens causes sensitization and then actually increases your risk of becoming allergic to that product.
So just to clarify for everyone listening, in case we weren't clear enough, even if you've used something, a sunscreen, a shampoo, whatever it may be, if you've been using it for your whole entire life, at the drop of a dime, you can become allergic to this, just like that, and then all of a sudden not tolerate it anymore. Sometimes people have a hard time believing it, but we see it all the time.
100%. I've sent patients for patch testing, actually figured out what they're allergic to, say, hey, you should avoid anything with cocomitter, propyl, betaine in. The patient gives it a couple of months and they go back to that cleanser and they break out again. It will happen, unfortunately, for the rest of your life. And once you're allergic to one skincare ingredient, your risk exponentially increases to become allergic to more.
And Neosporin, I swear, Neosporin is a ticking time bomb. Someone will be using it one day, it's just boom, all of a sudden, huge reaction. I mean, it just reaction that makes you hurt just looking at it. It's unbelievable the rash you can get from it.
I've seen that, and I mean, it's because we're putting Neosporin on an open wound. They say on the packaging, don't put what we know what people are using Neosporin for. Your skin barrier is not only compromised, it's basically gone, and then you're putting a highly allergenic antibiotic on there and thinking that you're not going to react to it.
It reminds me, the amount of times that I've been consulted in the hospital to go see a post-operative, post-surgical wound that is the consults for infection, but despite every antibiotic in the world, it's not healing. I can already assume, all right, the surgeon tried to use Neosporin
Exactly.
after the surgery, and the Neosporin is causing a huge allergic reaction. And the funny thing is many of the surgeons won't even believe me, but it really just takes some common sense to think about it. None of the antibiotics are working. It looks like an allergic reaction. That's what's going on. And the patient will say, oh, I've always tolerated Neosporin just fine.
And I've seen it in those post-surgical cases where they think that whatever they apply on top, like the dressing, they're having a contact dermatitis from the glue around the dressing. I'm like, think of the Neosporin that's actually right on the wound.
Totally.